The way that I think about what we're doing with our patients is we're helping them remember who they are.
Yeah.
And I think in psychiatry, that's such a vital thing. We can get caught up in these discussions about, okay, what are your symptoms? What's your PHQ-9? What's your GAD-7? What's your insomnia severity index? But wait a minute, what is this all for?
Welcome to Roots of Healing, the podcast where we uncover the stories, insights, and visionary ideas shaping the future of integrative and lifestyle medicine. I'm Dr. Siri Chand Khalsa, physician and advocate for embodied living. Before we begin, please note this podcast is for educational and informational purposes only. The views expressed by our guests are their own and do not constitute medical advice. Please check in and consult your healthcare team for personal medical concerns. Each week, I have the incredible privilege of sitting down with trailblazers and thought leaders who are reimagining what it means to heal both mind, body, and spirit. We're exploring their journeys, innovative approaches, and the deeper roots of healing that inspire us all. This week's guest is Dr. Nishi Bhopal, who's board certified in psychiatry, sleep medicine, and integrative holistic medicine. She's the founder and director of Pacific Integrative Psychiatry, an online practice in California that I'm very familiar with and have sent many people in that direction, where patients receive a whole person approach to anxiety and sleep disorders, including nutrition, coaching, integrative, and functional medicine. In addition to her private practice, Dr. Bhopal is the founder of IntraBalance, an educational platform for physicians and therapists that includes a YouTube channel and online courses on clinical sleep medicine for healthcare practitioners. Her passion is making clinical sleep medicine easy to understand and accessible to all. How exciting to welcome you to the podcast today. Welcome.
Thank you so much for having me. I'm so excited for this conversation.
Well, I always love hearing more about each person's sort of unique process that got them to the space where we are today. And I feel like for our listeners, we have a mixture of people that both have clinical backgrounds and people that just happen to have connected with my work through the years that aren't as familiar. But I always love hearing about your origin story, almost like your X-Man or your Marvel Avenger. How did you kind of come into such an innovative approach to medicine? Dial us back to what we might call that wake-up moment, and then what were the decisions from there?
Well, I love that analogy of the superhero or the X-Men, because I did kind of feel like a mutant in the world of medicine. So yeah, when I went to medical school, actually, I didn't really know what I wanted to do with it. It was really a path that was encouraged by my family. My dad's side is he's a doctor. I come from sort of, medical traditions in that side of the family. And my mom's dream was always to become a doctor. So it was one of these things that it was like, well, okay, when I finish university, I'm supposed to go to med school. That's how I entered it. And I thought I was interested in pediatrics. But as I went through my rotations and I started learning more, I kind of was one of those students who liked everything. I thought everything was so fascinating. And I liked psychiatry, I liked internal medicine. And so I ended up actually choosing internal medicine when I finished med school. So I applied to the match, I got accepted to an IM program, and I very quickly realized that it wasn't exactly what I thought medicine was going to be like. I went to med school in Ireland, and so they have a different approach to medicine there. And so I came to the US for residency, and we're spending 10, 15 minutes with patients. And I wanted to ask them, like, what's going on in your life? What are you passionate about? Do you like your job? Tell me about your relationships. And one of my IM attendings said, Nishi, you can't do that. We don't have time for
Right? How dare you?
Yes, how dare you talk to people? So I ended up switching to psychiatry after my intern year in internal medicine. That just felt like it was a better fit. But even then, it wasn't quite right for me. I still felt like there was dimensions and elements of healing that we really weren't touching upon. At that point, I got introduced to sleep medicine. So I didn't even know sleep medicine was a thing you could do. One of my seniors from internal medicine went into a sleep fellowship, and I thought, okay, that's neat. What's that all about? So I started doing rotations in the sleep clinic in my first year of psychiatry. So that was really my second year of residency. And I loved it because I was seeing so many patients in the psych clinic who were struggling with sleep. And I felt like the only treatments that we were offering them were medications. So I was learning more about sleep. And during this whole process, I was experiencing my own issues with burnout, my own issues with anxiety, with feeling like, wait a minute, whose path am I on? Am I on my family's path of what they want me to do? Is this really what I want to be doing? And that's when I discovered yoga and meditation. And so that took me on a personal journey of exploration. And it really opened up this whole world for me with regard to integrative medicine, Ayurveda. Wait a minute, there's all these things that we can do. And why are we not talking about this in my training? And so that's kind of how it all started. And so fast forward to the present day, I bring in all of those elements into my practice. So the integrative medicine, some yoga practices, sleep medicine, and really trying to offer people the best tools available from all of these different approaches.
What an incredible journey. I always love hearing about how it kind of all came together. And there's so many people who sort of wonder, what did you say to your family who have that more traditional background when you started sort of stepping into these other pathways? Was there a particular process or words that you used, or did they just kind of see that you were happier? I'm just curious, like, how did you bring your family along for this when they probably have maybe a more conservative, but I'd be curious to know.
That is such an interesting question. So I got all kinds of different reactions from people, family members and people outside of my family as well, especially when I transferred from internal medicine into psychiatry, especially on my mom's side of the family. They were very, the Indian family, right? So what will people think and all this kind of stuff was coming up. And there was this idea that cardiology is the best specialty. And so that's what you aspire to do.
Right.
I don't know why that's become sort of this revered specialty, or at least it was back then.
Right.
Hopefully that's changed. But yeah, so when I told them that I was switching into psychiatry, they just didn't get it. Why? What is that even? Why would you do that? Interestingly, though, there's also a tradition of integrative medicine and homeopathy on my mom's side of the family. My maternal grandfather was always interested in that. He was an engineer by training, but he had kind of this side passion for homeopathy. So I used to hear stories about yoga and Ayurveda and integrative medicine growing up. And I always thought it was pseudoscience or whatever, right? Like, yeah, okay, that's not real medicine. That's not real science. So there was a full circle moment when I became interested in that. So there was support for that, interestingly.
Was your grandpa still alive when you really started doing this? So could you reach out to him and ask him questions and things like that?
Yeah, so he's still alive to this day, which is amazing. And that's a whole
testimony
other thing.
in of itself.
Yes,
right?
Absolutely. And, he's a survivor of the 1947 partition. And so that's just amazing. And yes, so yeah, I mean, his face lights up if you ask him about homeopathy, and he's got all these books on his bookshelf at home.
Oh, wow.
And then my dad is actually a psychiatrist. And so he followed a similar path, different, but similar. So he was a GP for many years. I grew up in Canada. So he was a general practitioner. And then I think after a couple of decades of practicing, he did a psychiatry residency. He went back to school. Yes.
So there was definitely some fun modeling that had been there. Where is your family from before Canada? What part of the world?
Yeah, so my family's from Punjab, India. So my mom grew up there. She came to Canada when she was about 14. My dad actually moved to Scotland at the age of 5. So his parents moved to the UK in the 1950s. So he grew up there. So my dad's side of the family is all in England and Scotland.
Mm.
Yeah, but originally from Punjab.
That's so interesting. My husband's family follows a similar journey. His dad grew up in Wales. And then when he and his mom got married, they moved to Canada. They were in Winnipeg. And then when my husband was around 6, they came to Southern California. So that's a small world.
It's so similar.
But, it's interesting to think about the journey of a family and hopes and wishes and dreams, but also still staying true to that authentic spirit of exploration that just is such a beautiful part of being in the US or Canada. So what was the point at which How old were you when you first thought, maybe I want to be a doctor? Were you quite young, or was it something you kind of discovered as you got older?
Yeah, I think I never really had that thought. Again, it's one of those things that I heard growing up. Well, when you're a doctor, you'll be able to do all of these things, or
Mm,
oh, you would be such a great doctor. So it was kind of this idea that was highly encouraged. But when I was younger, I was interested in so many different things, especially literature. I loved to read. I still love reading. I still love literature. And I was really interested in creativity. At one point, I wanted to be a fashion designer. I used
oh,
to have a sewing machine and I would make my own clothes and design clothes and
oh,
make
fun.
little handbags and things like that. And so I thought, okay, well, maybe that's something that I could do. But really, this idea that, well, that's not practical
Right.
was sort of, driven home. And so I went to university. I studied everything. I studied English lit, biology, anthropology, languages. I loved French. I loved Hindi. So I got as much of an education as I could in undergrad, and then eventually decided, okay, well, medical school seems like a good idea. That
Yeah.
makes sense. And
Let's go ahead and do this.
do it.
How different is the medical school process in Canada from the US? Is it pretty dramatically different, or was it easy and was residency there or here?
Yeah, so I went to medical school in Ireland. So
Oh, that's right.
I did my undergrad at UBC in Vancouver, British Columbia. And at that time, I mean, I think it's not dissimilar now, but at that time there were very few med schools. There were only, I think, 10 med schools in Canada.
Well, that's not many. Yeah.
Not many, so it was very, very competitive back then. So I ended up, I went to the bookstore. It's called Chapters. It was kind of like a Barnes and Noble. So I went to Chapters and I was browsing the books, and this little book jumped out at me. It had a yellow spine and it was really thin, and it just kind of caught my attention. So I picked it up and I flipped through it, and at the back it had this blurb about this thing called the Atlantic Bridge Program, which sends students from Canada and the US, but mostly Canadians, across the Atlantic to Ireland to study medicine. And that's where I got that idea. Oh, okay, that's something that I could do. That sounds like fun. And I had this urge to kind of get out and explore the world. And, I could do that and go to medical school. So a friend of mine from college and we applied together. We got in together. And so the two of us packed up and we moved to Cork, Ireland for med
Wow,
school.
that's
Yeah.
incredible. Is Cork a small town? Was it very kind of colloquial, or is it a bigger, more metropolitan?
Yeah, so I think it's one of the sort of larger cities in Ireland, but small. I mean,
By scale?
for me it was small, coming from Vancouver, Canada. And at that time, I'm sure it's changed now. I haven't been there for over a decade, but at that time there weren't a lot of people of color. There weren't a lot of people from other countries, except for international students like myself. So it was a culture shock. It was a shock in lots of different ways. In terms of the medical system, that was different. Education was different. Just the culture was different. But I loved every minute of it. Yeah, it was
Fantastic. You just
exciting.
jumped right in, it sounds like. And so was it 4 years or 5 years then to
Yeah,
finish?
5 years.
5 years, yeah. And then you match into the USMLE process. That is so interesting. I didn't realize. So who knows, maybe we have an applicant who's looking for a non-traditional learning pathway. And I always say you never know where the conversation takes us, and who might be listening that could be looking it up now online saying, maybe this is a path for me. What would you say is sort of a real gift that came from, besides just being out of your own element? What are some principles that maybe you notice, like a pretty important distinction between how medicine is viewed in the two countries?
Yeah, that's an excellent question. And I think the biggest gift for me was being able to take a really good clinical history and make a diagnosis without any expensive tests. That's how we were trained. We were trained in that very traditional William Osler type of medicine, where it was all about observation, asking really good and pertinent questions, and being able to really make an accurate diagnosis without any fancy tools. And so when I came to residency in the US, so I did my residency in Michigan, in Detroit, Michigan, at Henry Ford Hospital. I remember on one of my first rotations, one of the attendings stopped and said, "That was the best history I've ever heard. Where did you learn how to do that? And I was like, well, this is just how we were trained in Ireland. Like, this is just, everyone does it like this over there. And I bring that spirit into my clinical encounters now. And, I've had patients tell me that, like, wow, no one's ever asked me that before or made that connection before. And these are all, just basic medical principles that that's just the way that people are trained in the UK and Ireland.
Yeah, I think sometimes our advanced models get in the way of our common sense. My residency was at Mayo Clinic, so we had just whatever at our fingertips. And sometimes it's like, well, what did the patient tell you? What was their version of why they're here or what's happened? Tell us a little bit about then that pivot to where exactly in that process did you really start thinking about yoga and Ayurveda and other options of learning? And where did you go initially to study a bit more?
Yeah, so I started learning yoga just personally. When I was in university, really, I had an interest in it. But I took a yoga program when I was in residency. And so this was called Inner Engineering. It's through the Isha Foundation. And that was the first time I really learned a practice, like a Kriya yoga meditation practice that I could use every day as a tool. And my experience going through that was really life altering in so many different ways. Just one from a physical perspective, it helped me have more energy. I'd always struggled with sleepiness and fatigue. That was actually one of the other reasons I was interested in sleep medicine. I felt like I could never get a handle on it. So it helped me with some of those symptoms, but it also just opened up these dimensions, and it's really hard to explain, but just I felt like I was touching other dimensions of existence that I'd read about, but never really experienced firsthand. And so that made me really curious about what is this? What is going on here? And so I started looking into courses in integrative medicine. So I took some courses through the ABIHM. I think now it's the ABIM.
Yes, of course. Probably that would have ended, around 2008 or 2009, I think, when they made the board and started switching over their format.
Yeah, exactly. So back around then, so I started taking courses through them. I took some courses through Maharishi Ayurveda. They have like a healthcare practitioner certificate. So for any Western trained doctors, you can take this course. It's a very introductory course, but I really enjoyed that and got some exposure. And I did a lot of sort of piecemeal courses here and there. And then I did the Integrative Psychiatry Institute fellowship that just came out in 2018, I think was the first year
relatively new.
Relatively new, yeah. But it was the first time I'd seen a comprehensive program in psychiatry that was integrative. And so I did that. Now I teach for them. I teach their integrative sleep module.
I mean, of course. That seems like, yes. Well, and I think what I've seen in terms of just the growth and expansion of integrative perspectives is that it takes a good decade to really figure out the nuances. Maybe you start getting the hang of it at 5 years, but if you're bringing in the integrative model, it really takes many patient interactions and internal reflections and reassessments, because there's no, perhaps you might disagree, but there's no one formula, right? When you take it tell us a little bit about your perspective on there's no one formula.
Yeah, I absolutely agree with that. And I think you're right. And it's such a different way of thinking than how we're trained in conventional medicine, in Western medicine, that we have these guidelines that we follow and we're fitting a treatment to a diagnosis. Integrative medicine kind of flips that on its head. And it really does. Yeah, it really does. And we're not matching up and it can be easy to fall into that trap, I think, with integrative medicine sometimes, that, oh, you have this symptom, take this supplement instead of take this medication. And so to get out of that way of thinking, it takes practice. It's an undoing of a lot of what we've learned. But then integrating that with the conventional Western style of medicine, I think it's just such an art form. So, how I approach it with patients is I really just try to find out where they are, meet them where they are. And what are your experiences? What are you interested in? There's different things we can explore. And I really let them guide the path, and I'll offer them suggestions, or if they're not sure where they want to go, I can give them some options to explore. but really it's a partnership and a conversation, and it's an unfolding of exploration with them, which is very different than how we're
For
trained.
sure. And it has, we can go into the Ayurvedic frameworks, the Roga, right? This notion of who is the patient that has the imbalance. And that, boy, when I studied Ayurveda, that really, really turned everything upside down. Tell us a little bit about what your practice looks like now. So you went through this really incredible education arc, and now tell us, what does it look like now?
Yeah, well, I feel like my practice is always undergoing renewal. Dr. Una, she's a physician coach. She always says your practice is a construction site.
Yes.
And that's exactly how I think about my practice. It's constantly changing, and I'm even in the process of pivoting it right now. So essentially what we do is it's a telehealth practice. We do integrative psychiatry and sleep. So we see patients across California, and we mostly focus on anxiety and sleep issues, but we'll help people with depression and other things that are adjacent to those kinds of issues. And we really do take this integrative approach. So that what that means is that we blend conventional medicine. So we're not anti-medication. We'll use medication when it's appropriate. We'll use nutrition. We use evidence-based psychotherapy, CBT, ACT, and various modalities. And we'll blend that with meeting the patient where they are. So if they're interested in exploring spirituality, yoga, if they want some Ayurveda, if they want to maybe go more into functional medicine, we have a functional medicine practitioner on our team. We'll support them through that process. And, ultimately the way that I think about what we're doing with our patients is we're helping them remember who they are. And I think in psychiatry, that's such a vital thing. We can get caught up in these discussions about, okay, what are your symptoms? What's your PHQ-9? What's your GAD-7? What's your insomnia severity index? But wait a minute, what is this all for? And what do you want in life?
Right. Yeah.
And, can we connect back to that?
Can you make that picture sort of more complete for them? I think that to me, this is one of the most fascinating things about how practices are evolving, because can you look out and see a mentor who's doing it like you are? Probably not, right?
I feel like I have so many mentors for different things. But yeah, I mean, it's such an interesting process to figure out what my practice looks like. What's my philosophy? What's my method? Not that, it's not coming from what I want, but just, what's needed in this space, and how can we provide that in the best way possible?
Because I think that the notions of integrative and holistic have really sprouted in our career span. So I finished medical school in 2005, but I had taken a 4-year gap. So, I'm early phase. And I feel like there was sort of a couple of really prominent thinkers who started way before us, who created curriculum. And then now there's sort of this emerging quality of many people who sort of see the value of who is the patient that has this imbalance versus and this is, truly the Osler mindset, right? And we've really, in some ways, lost sight of it. Okay, so thanks, everyone. We took a little break for tea sip because our throats are dry. We're in the winter season, which, of course, is the kapha time of year, and we're all juggling post-holiday sedentary, kind of qualities. Which brings me to kind of an interesting question. I'm really curious about some perspectives you have in your practice, but I'd love for you to give us your point of view on what equals circadian rhythm, because there is theories from Ayurveda, there's theories from modern science, and there's also just your lived experience as a clinician. So sometimes people can quote off a study, and that's awesome if you have that at your fingertips. But I also really appreciate hearing it from clinicians who live in it and they're thinking about it every day. And there are not a lot of clinicians that think about the power that lives in our circadian rhythm. So if you could speak to that a little bit, I would love it.
Wonderful. Okay, this is one of my favorite topics because when I was in my sleep fellowship, when I started learning about circadian rhythms, and I don't know why it wasn't talked about before, to be honest, because it affects everything, even like the timing of, taking medications, and of course your sleep-wake cycles and hunger patterns and hormone secretion, it affects everything. But when I started learning about it in my sleep fellowship, I thought it was so fascinating because our modern understanding of circadian rhythm, it's so aligned with Ayurveda and the ancient understanding of body clocks and daily rhythms and how to structure your daily activities and all these kinds of things. And so a few things that I see in my practice and what I talk to my patients about are, one, that everyone has a slightly different body clock, actually. There's no one size fits all approach, because sometimes patients will come to me saying they heard on a podcast, I need to get sunlight at, 20 a.m. or, these kinds of things. And sure, that might be helpful for some people, but it may not be appropriate for others. And so I really like to help patients dig into what their body clock is telling them. So, for example, there are genes that regulate circadian rhythm. They're circadian genes. They're called clock genes. There's other ones as well. And some people are programmed to be a little bit more of a night owl or have what we call a delayed sleep phase. There are other people who are programmed the other way. So we'd call them a morning lark, or they have advanced sleep phase. And in our modern industrial society, we are sort of expected to work this 9 to 5 schedule, which works for a lot of people, but not everybody. And so I start to see people struggling, especially if they have more of that delayed circadian phase and they're trying to fit that into a standard 9 to 5 schedule, or if they're a student, a 7 a.m. schedule in some cases. And that misalignment is where we start to see problems arise. And so I'm actually working with a young woman right now. She's probably in her early 30s, and she's got quite a significant phase delay. And I'll counsel people on strategies to help them shift their body clock. You can do it very readily without medication. You can do it with a bit of low-dose melatonin and light therapy. So that's really fun. But also I'll talk to people about, well, what lifestyle makes sense for you, for your body? How do you when do you feel your best? How do you feel your best? And are there ways that we can really enhance that and cultivate that? And I've had patients who actually changed their work schedule to fit into their body clock rather than the other way around. And that was more conducive to their mental health, to their physical health, to their overall well-being. So I guess the biggest takeaway is that there is no one size fits all. But the second piece is that once you have kind of figured out what sort of works best for you or whatever schedule you need to be on, then you want to maintain regularity as much as possible.
The rhythmicity. Yeah.
The rhythmicity. And there's 3 main zeitgebers or cues for the circadian clock. And these are the timing of light exposure, the timing of meals, and the timing of physical activity.
Oh, isn't that interesting? So how many people do you think know about the physical activity piece?
Yeah, I think not a lot.
Like
not a
zero?
Lot. Zero.
I'm going to do an informal poll. I mean, I happen to know because at the beginning of the pandemic, and I might put it in the show notes, there was a wonderful sleep review from the Harvard Sleep Clinic, which I think is where, did you do your fellowship there? Right, we'll talk about that in a second. But they had this wonderful paper in 2020 that outlined sort of parameters. And in that, it was so aligned with the Salk Institute. He's got that circadian clock work, and I've forgotten the gentleman's name, and then Ayurveda. And the combination for me was like exercise and also social interaction, they said. But those 3 are probably the biggest ones. But if we look at Ayurveda, it's like your dinacharya, your daily structure, is one of the primary determinants of your health outcomes. We never tell patients that. Now, once you've studied Ayurveda, you're like, how did I not know that? And it permeates through every clinical conversation you have. You can't actually unsee it or unhear it or unknow it. But then when the data starts rolling in, it's really exciting. And how quickly can someone in your clinical practice, or what you've seen of course, this is not a substitute for someone who's listening, but what are a substitute for talking to a sleep expert? Of course, we want to preempt that. But when people start making conscious changes, is it immediate, or do changes really show up? At what point do you stop seeing the beneficial impact? Is it 9 months or even up to a year? When they're really routine in their schedule?
Yeah, such an interesting question. And so I just wanted to piggyback on what you were saying about the daily routines. And so there was a study that came out, I think it was last year, maybe the year before, on sleep regularity versus sleep duration. And they found that sleep regularity had more of an impact on health outcomes compared to sleep duration. And
Wow.
a lot of people focus on, oh, okay, I need to get my 8 hours of sleep or my 7 hours or what have you. They're focused on that number, and not as much the regularity. But the data is supporting that actually having a more consistent, and what regularity means is kind of waking up around the same time every day. So being more consistent with that is actually going to have a bigger impact on health.
Mm.
Now, what I've seen in my practice is that starting with circadian rhythm, that's usually where I start when people are struggling with sleep issues. Often people will start, they'll focus on the whatever happens an hour or two before they go to bed, right? Should I take the magnesium? Should I use my blue blocking glasses? All these kinds of things. Okay, sure. Some of those things can be helpful, but let's talk about what you do first thing in the morning and how you go through your day. And sometimes within a few days, people start to notice improvements. I just saw a patient earlier who has been struggling with chronic insomnia for a couple of decades. And so we started working on her circadian rhythm. There's other things too, of course, but circadian rhythm is something that everyone can do. It's very tangible. And after 3 sessions, she came back and she said, my sleep is starting to stabilize. I never thought that was going to happen.
Right.
Within a couple of weeks, people can start to notice those improvements. I just encourage anyone listening just to tune into yourself, because for some people, they can see improvements within a few days or a few weeks. For others, it might take a few months. It might even take longer. But just start to notice, what does it feel like when you have a consistent daily rhythm? Maybe do an experiment for a few weeks
Yeah.
and see what that's like, and just see how different things affect you.
Right. It's so fascinating because I think, well, the listeners by now know that I have had long COVID, which has been really, really challenging. And I've had to really lean into a lot of my training to sort of adjust in it. But I always like to ask if you have any particular literature on the sleep architecture disturbances with COVID, because for sure, I was a sleeper before COVID, and now I am a new type of sleeper with my long COVID. And I think that it's very multifaceted, of course, but I've had early morning awakening for 5 years now, and it's just been, I've tried a lot of things. And the one that works for me, which I think is kind of fascinating, is that if I fast, it works. I sleep through the night, but nothing else works. And I haven't really gone down a pharmaceutical path, but and this is a lot of my own personal health, and I'm not actually asking for any medical advice because I have explored it extensively. But I'm just fascinated by that because I sort of stumbled on it. And then I understand that there's some pathways that might be activated through fasting that might be beneficial. I don't know, we have listeners that have long COVID just because I'm a bit vocal about the fact that I've had to do it. Do you have any thoughts for people who maybe fasting didn't work for them, or all the, what are some ways to approach the long COVID sleep disturbances? And do you have any data that tells us like what the heck?
Yeah. Yeah, so I'll have to look up the research and see what the latest is on long COVID and sleep, because I remember looking this up a while ago and there really wasn't that much out there. I don't know if you may know
No,
more than
there
I
really
do about.
isn't. Yeah. But anecdotally, when I talk to people, they say, yes, it seems like people with long COVID have sleep architecture disturbances, and whether it's sleep apnea or depression or anxiety that's become unmasked or something else. But for me, I was like, yes, all of the above. Okay, fine. We've dealt with those, but we're still waking up at 4 a.m. So then when I started fasting, then I slept through the night. And that was it's like clockwork. And it's hard because, and maybe you could even speak to this, because you have these routines with families and friends, and sometimes people need to make really strident adaptations in their daily schedule. I do best going to bed at 8 p.m. I wake up at 4 a.m. generally, whether I've slept a full night or 90 minutes. Like, I don't know what all the dynamics in my biochemistry are, but I've been that way since college. Like I am an early bird. I'm one of those morning larks, I guess you could say. And when I would do night shifts, there was no sleep. Like I would come home from the night shift, I'd have like ground mal glasses on and black out everything and, try to do all the things to help me sleep. And even sometimes with pharmaceutical support, I would sleep 2 hours and then I was just awake. So anyway, I've been rambling on here, but I'm curious if you have seen anybody respond to insomnia with fasting, if that is something even independent of the COVID, and what maybe a proposed mechanism of that might be.
Yeah, so I have seen people improve with fasting, and just, I'm also someone who sleeps better when I fast. So I just know subjectively that if I have a period of at least 3 to 5 hours before going to bed, I'm going to sleep much better. And I wear an Aura ring as well, and I do see improvements in my heart rate variability, which is kind of like a substitute marker for sleep quality in some ways.
Right.
So I see improvements in that, and it does go down. I was out with friends over the weekend, and we had a late meal because it was the only reservation we could get, which was late at night. So we're like, okay, fine, let's go for it. And I just knew I wasn't going to sleep well that night, and I didn't, and my heart rate variability tanked. I'll see this with my patients as well. But again, it's so variable because there are people like us who sleep better when they fast, and then there's other people who they'll wake up in the middle of the night with hypoglycemia, right? Or a cortisol surge because of a drop in their blood sugar. And those are people who probably need to have a high fiber, high protein snack about an hour before they go to bed to stabilize their blood sugar. And there's no real way to test for that. I mean, you could do a CGM, I guess, if you want to check your blood sugar, but just to see like, okay, who's going to do well with fasting and who's not, it's very, very subjective. And again, it takes a person tuning into their own personal experience.
Right. And I imagine that's partly when people work with you, you all introduce all kinds of variables, right? This is what makes the model. And I want to talk about how you're inspiring and teaching others here in a second. But isn't that interesting to think about how unique, like maybe someone who was seeing someone who wasn't integrative minded or who didn't understand some Ayurvedic principles, or that they might never be told you could try fasting to see if you sleep better. But for you and me, we'd be besties. We'd be like, dinner's at 2:30.
Yes.
It's going to be delicious. We're going to eat everything we want. And then we might have like a little sip of something before bed or a couple hours before bed. But when we put our heads down, there's nothing, literally nothing in our stomach. And yeah, we would be best friends because no one understands me. I'm always like, can we go for lunch? Like eating dinner out is, especially with the COVID, because when I don't sleep well, then I'm really off the next day, like really off. There's not as much resilience. Anyway, so I digress. I think it's so incredible when you have this additional training that the assessment and the curiosity and the questions and the testing, and that's hard, I think, to teach. It's hard for patients who aren't used to that. And so do you have kind of a standard way you introduce your process to patients who may be not familiar with doing, practicing medicine this way?
Yeah, I do. So I've got an intake form. So all of our patients fill out an intake form before their initial visit. And it goes into all kinds of questions. And a lot of them are pulled from Ayurveda, but it's not presented as such. So we're asking about their meal times, their daily structures, their daily routines. We'll ask them about bowel movements and things like that. And I've had patients say to me, like, no one's asked me about my poop before when talking about sleep. But yes, it is relevant. So, that's kind of the initial process. But what I tell people is that, look, this is a very personalized thing that we're going to be exploring. And we're going to be paying attention to all of these different factors. And I like to break it down I like to keep it bite-sized for people, right? Otherwise it gets overwhelming when you're like, oh yeah, there's 50 million different things we need to look at. Then no one wants to engage in that.
Right, for sure.
So I'll break it down into 3 main categories, which I call the CSH framework. Now my voice is going.
Pause. Yeah. Here, hold on. I'll take a sip too.
Okay, so I break it down into three categories, which I call the CSH framework. So C stands for circadian rhythm, S stands for sleep drive, and I can explain what that is in a moment. And then H is hyperarousal. And hyperarousal is anything that might be causing activation of the nervous system. And that could be medical issues, it could be blood sugar fluctuations, it could be thyroid issues, but it also could be anxiety, stress, depression, and other things in that category. Trauma as well as a big one. Sleep drive refers to the pressure to sleep at night. And it's like hunger. So I'll use that analogy with patients that if you eat a big snack before dinner, you're not going to be hungry for dinner. So if you're sedentary or taking naps or resting a lot during the day, you're not going to be as hungry for sleep at night, right? So now this doesn't mean you have to be running a marathon every day, but there are things that you can do to increase your sleep drive, to remain a little bit more active during the day so that you have more of that pressure to sleep at night. And so in those three categories, there's lots of different subcategories and different interventions that we can introduce.
That's incredible. Understand that you're also teaching clinicians with your Intrabalance. So tell us a little bit about the translational quality. I'm sure you reached a certain juxtaposition where you were like, wow, other people may not know these pieces work. And generally, from my standpoint, clinicians actually want people to be better. I think sometimes this is this misnomer from the general public that somehow doctors have something to benefit by people not healing. We're in kind of a strange era right now. I actually have never met anyone like who really, not to belittle someone's belief system, but like I really have been either very fortunate or just how people interact with me. But I've never really come across someone who didn't want the best outcome for their interaction with a client. But sometimes they're limited by their training, their personal belief systems, the environments that they're practicing in, the patients that they work with. But it sounds like you have begun to see a need here to bring a model like this to a larger group. So tell us a little bit about, first of all, an entrepreneurial journey is a whole crazy thing. So take us to that little light bulb moment and tell us a little bit about both the entrepreneurial pieces and also what the actual process, what you're offering.
Great. Yeah. Okay. So the entrepreneurial piece started during COVID, during 2020, when we were on lockdown, and loads of my patients were struggling with sleep issues. And I felt like I was hearing the same things over and over. People were anxious, they couldn't sleep, they were fatigued from working at home and not getting sunlight exposure during the day. And there were so many things going on. So I thought, well, let me put this information on YouTube. And I was part of this physician summit that was really inspiring with Peter Kim's group. And I thought, well, I can try that. Why don't I try doing YouTube and putting some videos out there, and maybe it'll help more people. And I had this desire to sort of break beyond the walls of my clinical practice and provide information that I thought would be beneficial for more than just my patients. So I started putting this information out there about sleep and mental health as well, but mostly sleep. And the people who were responding to the videos were my colleagues. And I was getting messages from them and emails from them asking me to go into more detail on melatonin, or wait, can you say more about sleep restriction? How does that work? Or what is CBTI? Where can I send my patients for CBTI? So I'm getting all these questions and I thought, oh wow, there's really a need here to educate the doctors. And when I started looking into it, I found out that on average, doctors get about 2 hours of sleep education in medical school. Right? And that's pretty consistent around the world. Most physicians around the world are getting 2 to 4 hours of education. Some doctors get 0 hours, depending on their medical curriculum. Some people might get a little bit more, but it's not that much. And when we do get trained on sleep, it's usually maybe a bit about pharmaceuticals for insomnia, maybe a bit about cognitive behavioral therapy for insomnia, and then some training on sleep apnea and obesity hypoventilation. And that's about it. Right. And
That's
maybe a
right.
bit of muscles leg, right? Yeah. Or a lecture on REM behavior disorder or something like that here and there if you're doing a neuro rotation. But that's about it. Yet all of our patients have to sleep. Every single human has to sleep. Right. And so we all deserve to have this information. And I was also getting curbside consults from my colleagues about their patient with insomnia, and I'd look at the case and wait a minute, this person sounds like they have sleep apnea, or it looks like they have restless leg. Have you checked a ferritin level? Oh no, I didn't think about doing that. So all of these kinds of things were coming up, and I thought, okay, there needs to be some more training around these sorts of basic things. And it's not the doctor's fault. It's just that they haven't had the training and they don't have time. They're busy, right? They have so many things that they need to learn. So that inspired me to sort of pivot. So now my YouTube channel is for the practitioner to learn the basics of sleep medicine, and through an integrative lens, really finding ways that are non-pharmaceutical. There's a role for pharmaceuticals, but what else can you do? And so that's my mission. And I have an online course for practitioners, and I'm developing another one actually as we speak, specifically for insomnia for practitioners to learn. And it's just so much fun, and I love it. And yeah, it's also scary to put yourself out there, and it's vulnerable, and sometimes people have not nice things to say. And so it's a challenge personally in many ways too. It's been a process of personal development to also find my voice as being someone who's historically been very shy and socially anxious and wanting to hide in the back corner. Mm-hmm. So there's almost a therapeutic aspect to it, to
right, an arc of your own healing, right? And we can't deny our healing in our work and in our journey, because that would be wrong. I guess I could say it simply. What are some of your criticisms of modern sleep medicine? Like, what kind of gets your ire? Like, I'm hearing this again, or why are we still saying that? Is there anything that kind of, don't get me started, right?
I feel like there's a lot. So there's kind of two things I would say in this category. So one is with regard to women's sleep health. And I feel like women are just so frequently brushed off. Our concerns are brushed aside. And as you were just sharing your own challenges with long COVID and these early awakenings, I mean, I've seen situations like this where women are now put on antidepressants. Oh, you have early morning awakenings? Okay, so you need Zoloft. And their concerns are really being dismissed and not being investigated. In women, sleep apnea shows up very differently. So I'm always on the lookout for that. It looks like chronic fatigue. It looks like depression, like fibromyalgia, aches and pains. It does not show up necessarily in the classic way that it does in men. And so I see lots of women being misdiagnosed and mistreated. So that's number one. The second thing is that insomnia is not always insomnia. So I'll have patients who are referred to me, like the young woman I mentioned with the delayed sleep phase. She had seen multiple psychiatrists and been put on different sleep aids like Ambien, Trazodone. She'd gone through the whole cycle of them for this purported diagnosis of sleep onset insomnia. And she actually had a delayed circadian rhythm, which is not to be treated with medication, and actually is very readily treated without. So for anyone listening, whether you're a practitioner or you're wanting to optimize your own sleep, just remember that insomnia is a symptom of something else. So it can be a symptom of another sleep disorder like circadian rhythm issues, misalignments, sleep apnea, restless leg syndrome, or a medical condition or something else. So we want to look under the hood to see what's really going on. And there is such a thing as chronic insomnia too, yes, but it's not always insomnia. There may be something else going on.
But, like the thing is, and I think, ultimately we're just in an era where women need to use their voice, and we need to have, like, even if it's scratchy and weird and closing down because some other part of us is going, why are you doing this? Like, organizationally, there's some part of me that's like, why are you doing a podcast? Yeah. There's another part of me in here that's like, because our voices are needed and our perspectives are needed. And we often don't deny the value that women in medicine listen to women who come to see them. This is such an interesting distinction. I remember a doctor's visit I had in medical school to a male clinician. I won't go into too much detail. And it was so strange that I would see him to discuss something of this nature, and was such a disconnect for me. And of course they'd heard it all. They were, but they'd heard it all from women and dismissed it every single dang time. This has been in the 90s, right? So again, you got to wonder about the value. And we're recording this on National Women Physicians Day. And I think that I'm really celebrating people like you who are really bringing an authentic, evidence-informed, holistic approach that really allows self-agency. So meaning there's a lot of power that comes back to the individual, and it creates a really joyful, creative practice experience for you, right? So you also own your practice, right? You're not currently, tell us a little bit as we're wrapping up, what it's like to own your own practice and hire people and maybe even let people go when needed. What are some tips you have for someone who's like third year resident? They know they're going to work for someone else for a couple years just to get their bearing, but their goal ultimately is to be able to create something like what you're doing. What would you tell yourself at the beginning of this journey?
Oh, wonderful. Yeah. Well, first of all, happy National Women Physicians Day to you as well. And I mean, you're such a inspiration to me, and I'm just delighted to be here with you having this conversation. And just to your point about feeling dismissed, so Dr. Elizabeth Blackwell, who we're also celebrating today, the first woman physician in the United States, I read that she was inspired to go to medical school because a friend of hers was dying and said to her that I would have suffered less if my doctor were a woman. And it's so poignant, right? So, so thank you for doing what you do. Okay, so for the person who's listening, the med student or anyone who's listening, thinking about having their own practice, the advice I would give to myself is don't be afraid to pivot and explore. And even my practice right now, as it is, I'm pivoting it, because I had a lot of resistance initially to focusing on sleep. And I thought, well, no, I was trained as a psychiatrist. I need to do integrative psychiatry. And that's what I've been doing for years. And I kind of do sleep as a sort of carve out. But I really love working with sleep, specifically insomnia. It's just so much fun and it's so gratifying. And there's integrative medicine lends really well to treatment of insomnia. So I'm allowing myself to pivot and to niche down. And what I've learned about myself is that I actually like programs. I love teaching, creating content, and making things easy for people to understand. And so I'm shifting my practice to now be centered around a program that's going to be coming out later this year. So I'll keep you posted about that. Again, everyone's different. So I have colleagues who love having a large group practice and overseeing a network of practitioners, and that works really well for them. And what I've learned is that might not be the right model for me. I love more the content and the teaching aspects and the creative aspects. And so I'm allowing myself to shift more into that. And so again, for anyone who's listening, there's a world of possibilities. There's a universe of possibilities available. And when you're going through medical training, we're only exposed to like 1% of what can be done working in a hospital or going into academia, or maybe having a traditional sort of private practice model. But there is so much more. And I think just exposing yourself to people who are doing creative and exciting things, it just opens up the imagination. So let yourself explore and be creative.
That's incredible. Sorry. Well, I'm really delighted that we've been able to kind of have this time, and we could keep going, I'm sure, for another hour, but I know you have, I'm sure, a busy schedule in front of you. One of the things that on the podcast intake I ask people is like, what are some interesting other things? And you mentioned that you love organizing, and it seems like one of the things that you're good at is pattern recognition. And I'm curious, do you think that's a skill that can be learned? Or is it something that's just kind of how we're built?
I think it's a skill that can be learned. I think there are people who have that. Like for me, I've always just loved organizing and like how Marie Kondo, if you've ever watched her help people organize, she goes, I love a mess. Like that's me. I love a mess and I love to clean up the mess and to organize it. But I absolutely think it can be learned. Yeah. And it's really just about, like you said, pattern recognition. And when I actually helped my mother-in-law organize her front closet because it was a little bit of a disaster. And she said, how did you do that? And I showed her and I said, okay, you just put like items together and everything should have a place, and you just put everything in the same place and just make sure you put it back, and don't buy more of that thing if you
yeah, here's how to do it, right?
Yeah. So yes, I think in short, yes, I think it is a skill that anyone can learn.
And as we're sort of closing, I'm going to invite you to share information about how people can find you. But before we do that, could you share with me and I think I know the answer, but where you would like to see innovation in medical training and curriculum? I think we probably know what you're going to say, but say it anyway.
I'll say it anyways. I'll shout it from the rooftops. Yes. So, I mean, yes, absolutely. I think there needs to be more training on sleep medicine. And that's not to say that everyone needs to be a sleep expert or a sleep specialist, but just the foundations of understanding how sleep works, recognizing common sleep disorders, and knowing when to refer and where to refer. I think that alone could improve outcomes for so many patients.
I actually think I read something on even wound healing, right? So from surgeon perspective, they might think, oh, well, I'm not sure this applies to me, but what if restorative sleep helps immune function and wound healing, right? So there's no corner it doesn't touch in medicine and healing. And it's really the corner of one of the lifestyle medicine pillars. So it's been so delightful, even with my intermittent Kermit the Frog voice. We're just all hanging in here. But tell us a little bit about how people can find you. And I think you have a couple of different things you wanted people to be able to know about, if you wanted to just share those.
Thank you. So if people want to work with me or my team in my private practice, you can find us at Pacific Integrative Psychiatry. The website is pacificintegrativepsych.com. So we help people with anxiety and sleep issues, and our sleep coach can work with people anywhere. She's a yoga therapist and sleep coach, so she can see people in any state. But for medical services, we provide that in California only. And for practitioners or anyone who wants to learn more about sleep medicine, you can follow me at IntraBalance, that's INTRA Balance, on YouTube.
Fabulous. And I think you have a melatonin guide as well. We'll put that into the show notes, right? If someone wants to understand, we didn't get to melatonin, but you have some resources on your website that people might find useful. Is there a podcast on YouTube as well, or intermittently you're interviewing people, or am I remembering that wrong?
Yeah, no, I do. I do have interviews. So it's kind of a mix of just different sleep medicine topics that I teach, and then fabulous interviews with just amazing guests. This week we just had on Dr. Andrew Spector. He's the sleep medicine program director at Duke, talking about the new restless leg syndrome guidelines, which is really important for any doctors because it's totally different than the previous guidelines. So important update. So yeah, so we have fun interviews as well. Yeah.
Well, it's a great opportunity for people to really learn from someone who's not just creating CME content. And I say that with a lot of kindness. We have CME we have to learn, but not all CME content is really giving us the bones and pieces that give us tools to make our practices better. And I feel really excited about, and you have CME, I believe, with your offers too, right? Yes. People can really dive in, get CME, get the funding they might need to study with you. And I think that what you're doing is absolutely so innovative, so creative. And it's just been a delight, Dr. Bhopal, to spend this time with you. And I look forward to perhaps a future podcast having you back to dive into, so many. We didn't really talk about mental health. And I feel like there's so much there we could also, but I think sleep is still and will be for the foreseeable future here, something we want to think about really supporting people in.
Amazing. Well, thank you so much for having me.
Thanks, everyone, and tune in for our next episodes. Take care. Bye-bye.